This video will be covering the back half of infectious conditions. So we left off in the previous video at measles or rubella, and now we're moving into chickenpox and shingles. So chickenpox is a virus, a varicella zoster virus that usually infects kids. It's viral and highly contagious. And then herpes zoster, which is a variant of varicella zoster, is what causes shingles. So, and then shingles happens in later years of life following infection. So, signs and symptoms of chickenpox: there's going to be a rash. There's going to be lesions, little red marks. Usually last for 3 to 4 days. Eventually, they're going to crust over, and they will resolve. They're itchy. And then the patient's going to experience fever, chills, soreness, backache. So following the chickenpox, the herpes zoster, they will go and settle in the dermatome roots. And that's why when, I can pull up a picture, that's why when people develop shingles, you will typically see shingles along a dermatome distribution, because they will, it could settle in a cranial nerve, like the trigeminal nerve, but typically we see it in a dermatome level distribution inside of individuals. You guys can see several here, because it settles into those individual dermatome levels and moves on. Yeah, so return to play. If you work with someone with chickenpox, once their infection is resolving and then those crusts are going away, they're welcome to come back. They could have some antivirals, and then move forward. Okay, so we move into hepatitis. Remember, hepato is liver and itis is inflammation. So these are just diseases that infect the liver. It could be bacterial or viral. The liver is the largest organ in the body. Just as a reminder, it's got multiple lobes. The gallbladder is embedded. It aids in digestion. And then it stores several vitamins and minerals. It also stores nutrients. So it can store carbohydrates in the form of, they break down into glucose. Anyway, the name is escaping me. So anyway, the liver is it serves a very important role in metabolizing and providing energy for us. So we've talked about a couple of these in this class already, and I know that you have exposure to them. Hepatitis A, hepatitis B, hepatitis C, and then hepatitis D, which is it's not well known, and it's actually hard to identify. But just a reminder on the liver. So if someone manifests problems in that quadrant, that's where we're at. So here are the hepatitis viruses: A, B, C, and D. Incubation periods, and then how the things are transmitted. Okay, so hepatitis A is still alive and well. If someone develops hepatitis A, it's usually through oral fecal contact, poor sanitation, contaminated food, or water. It's one of those reasons I would never recommend to drink water that hasn't been filtered. You know, if you want to drink sketchy water, that's on you, but I wouldn't do it regularly. So hepatitis A is still alive and well. It has an incubation period of about a month, and then it'll come on. Hepatitis B and C, you'll notice those are going to be more of our bloodborne pathogens: infected blood, intravenous drug use. So hepatitis B and C come through those bloodborne pathogens, sexual contact on hepatitis B, and then viruses present in saliva, semen, and vaginal secretion, so body fluids. And then hepatitis D, intravenous drug use, and then, like I said, this one's a little obscure. I think I actually have a little information on it. So anyway, hepatitis A, oral fecal contact. Wash your hands after going to the bathroom. This is why we wash our hands after going to the bathroom. Inflammation of the liver. It's bacteria or viral. It has declined. So hepatitis A and B have both declined, but hepatitis C remains fairly consistent. Yeah, I guess not much to say on this one. Treatment, spontaneous resolution eventually goes down. They'll be a little sick. They might have a little jaundice. So try to not pass hepatitis A on. Um, this is what I meant on that hepatitis A. Poor sanitation, oral fecal contact. Here we go. Flu-like symptoms, dark urine, pale stools with some jaundice. Now, hepatitis B, sexual activity, right? IV drug use, bloodborne pathogen, or infected mother to baby. Yeah. No activity until asymptomatic, not infectious. Hepatitis B it lives a long time. It's tough to get rid of. There is a vaccine for it. As healthcare professionals, we should take. Hepatitis Z, again, it's a bloodborne pathogen, so we're looking at passing through blood, IV, drug use, multiple sex partners, needle sticks, or potentially during birth. And then, like I said, this hepatitis D Delta virus, it's linked to hepatitis B, but not similar, I guess. So I don't know much about this hepatitis D. Least common, sexual contact, IVs. Okay, so I'm going to cruise through that. I'm going to move into streptococcal infections. So streptococcal infections. A lot of us have had strep at some point in our lives. A lot of times strep throat is the particular one that we get infected with. So streptococcal infections are a bacteria that are found on human tissue all over the place, including GI, throat, respiratory system, vaginal or vagina, skin, and it's very common. Okay, so there's different groupings of it, and then these groupings manifest themselves in different places. So that group A, bacteria, this is typically the strep throat one, cause necrosis and inflammation, very painful. 15 to 30% of carriers are asymptomatic, and contact with infected individual to open membranes cause infection. Okay, so group B is uncommon in adults. Upper respiratory, gastrointestinal, and gastrointestinal infections. So much less common there. Okay, so though if you've seen someone with strep throat, you know it's going to be red, it's going to be inflamed, it's going to be angry. Sore rash, you might have the white bumps. If someone has a strep infection, antibiotics are a very good thing. So if not treated, strep throat can resolve on its own, but sometimes it does not. I think this 80% mortality rate is probably a little high, but it can resolve on its own, but it also may not. Okay, so once antibiotic courses start and the symptoms are controlled, athletes can come back, and honestly, it's 24, 48 hours, they're in the clear. So then we move into staph infections. So staph infections are a bacteria found on skin. Opportunist bacteria, and then it's methicillin resistant. Okay, so it's methicillin resistant. So signs and symptoms: small lesion which quickly enlarges, extremely painful, and then with a low-grade fever. You guys maybe have seen some of these staph infections. It seems like there's a staph infection that can identify every year on some sports team amongst one of our clinical sites. Okay, so if we notice a skin infection that looks like staph, then we want to isolate it, and then we're going to want to do some antibiotic treatment and get them referred quickly. Okay. Finally, the meningitis is viral or bacterial meningitis. Okay, so viral infection, most common. Remember, meningitis is inflammation of the meninges. Okay, inflammation of the meninges found near the brain and the spinal cord. Let's see, contagious virus that spread through contact and respiratory secretions. It happened, meningitis, it rears its head every winter, fall and winter, it seems like. If someone has meningitis, they will feel really sick, headache, fever, nausea, vomiting, Drowsiness, confusion. I did want to pull up these videos or these images. So this is Brudzinski's sign. So you just essentially are putting the nervous system on stretch, because remember, it's the meninges that are inflamed. So if you just put the meninges in a place where they're on stretch, what the patient will report is pain in their back. And here's a video on this.
Koenig's sign is an indication of meningeal irritation. With the patient supine, flex the patient's hip and knee. Then extend the leg at the knee. Back pain and resistance to straightening is a positive Koenig sign. When the sign is positive bilaterally, it is even more suggestive of meningeal irritation. Okay, Tom, I'm going to bring your leg up, and I just want you to tell me what you feel as I do this.
Back hurts.
Okay.
Okay, so you may have heard him. He just said his back hurts. So that's what you're kind of looking for on this meningitis. Okay, and then bacterial meningitis, similar. This one's going to be more acute, and then it's going to be sudden, and like I said, the patient will know. They will not feel well. So there are bacterial meningitis cases every year. If you're in this realm, you'll hear about them amongst high school and college age students. Sudden presentation. Again, you'll notice sore throat, fever, headache, stiff neck. They will not feel well at all. Severe sudden headache, high fever, stiff necks. Treatment, antibiotics. Okay, so that finishes this video on the back half of infectious conditions.